Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Beachside Roofing.
Well, aloha and good morning. Thanks so much for tuning in here for another edition of Spotlight Hawaii. I'm Ryan Kalei Suji, joined by Yunji Denise, and it's so great to see so many of you already tuning on in here this morning. Yunji, there is a lot happening throughout the state, a lot of issues. But of course, today we are going to spotlight tourism and focus on the hospitality industry in our conversation this morning.
That's right. We are joined this morning by Hawaii Tourism Authority CEO John DeFries. Thank you so much for joining us this morning.
Good morning. Good morning. Thank you.
We want to start out with the holiday travel season. Obviously, it's so important to the economic engine of our state. How is this holiday travel season looking so far? Who is coming to Hawaii, and what are the daily arrivals like?
You know, yesterday we received just under 32,000, of which 30% were either Kama'aina returning home or coming here to work. But in terms of pure visitors, I would say about 70% of that number. So 32,000 at this time of the year is roughly 85% of what we experienced pre-pandemic, but it's very much in line with what we anticipated. Now, you know, as we've seen over the weekend, the airline industry nationally has had to deal with some of the staffing issues that many of the businesses in Hawaii are dealing with in terms of the health and well-being of their own employees. And so it's a very fragile situation as we go into the holidays, but every indication appears to be that this will be a strong holiday season moving into the first quarter.
And despite some of these cancellations that we've seen, as you mentioned, over this week, how has that impacted just the overall visitor experience? Have you heard any word of visitors getting stuck here because of these cancellations? And overall, how has this Omicron variant impacted the ability of people to come to our islands?
Yeah, you know, good question, because, you know, we start right here at home. And as you and I know, over the last 20 plus months, the whole system in tourism, along with our entire community, has gone through basically a major shock, right? And we're still trying to find secure footing that can put us on a sustained trajectory toward growth. Back in March of this year, we thought we had turned a corner, only to run headfirst into the Delta variant. And then this fall, with the introduction of Omicron, we find ourselves having to adjust to that, not only operationally, but again, making sure that the work environment for our local employment workforce is safe, and subsequently protecting that safe area to greet the visitor. But, you know, from the outset, the cardinal rule and indicator is if we can keep the COVID curve flattened, we can sustain the reopening of our economy and the visitor industry. Every time there is a surge like this, we're having to accommodate that on the ground level operationally in terms of staffing levels, and it's having an effect on how the market responds to that. And right now, the primary market has been and continues to be the U.S. mainland. And so we are watching, you know, diligently the areas of the country that are experiencing surges of their own, because that's going to translate into how their consumers either move forward with their plans to come to Hawaii or choose to defer to a later time when their confidence is back about traveling out of state.
We had such an unusual summer season with a lot of first-time visitors to Hawaii, and really just all that pent-up demand, and I guess a lot of pandemic money at disposal. And suddenly Waikiki was sort of bum rush, as was communities in Maui and Hawaii Island and what have you. What are you seeing in terms of who's coming here? Are we having people who have been to Hawaii in the past and more of our typical visitor, even if it is not an international tourist? Or are these still new folks exploring the islands for the first time?
You will see new first-time travelers, but certainly not at the rate that you saw during the summer. I think the winter months, there's a seasonal pattern that people out of the cold states historically come to our islands. We would anticipate that these are much more seasoned repeat visitors who are counting on having at least part of their winter season in a warm environment. And I think what also aggravated us, the situation during the summer, as you recall, is we had restrictions in indoors and outdoors. And so when your restaurant capacity, when your capacity at visitor attractions is reduced by half, and then you're now operating at 100% capacity on visitor arrivals, that led to a disproportionate congregation and mess in certain areas that we don't want to replicate. Now, at the moment, we appear to have that capacity issue resolved so that restaurants have returned to some level of near full capacity. But again, we're going to have to watch the impact of Omicron and its impact locally to ensure that we can keep these full capacities going, because once they contract, it produces a logjam of visitor traffic, resident traffic that we're going to try and avoid completely.
We've heard of talk of adding in the testing requirement into the Safe Travels program. We know that there has been, of course, modifications throughout the pandemic, and that testing option became, required for those who are not vaccinated if they wanted to forego the quarantine period for those entering the state. Have you heard any word of the testing option being added back into the Safe Travels program, and your thoughts overall, if it should be implemented, how that will impact travel overall?
We have not received any definitive word, but I will say I think that we've seen the end of the trusted test partner program. There are enough test centers that are credible and throughout the state. It took a while to get to that level. So I don't see the trusted test partner program coming back. The key indicator for us locally is going to be hospitalization and the capacity of our hospitals to provide care first for our local community, and then whatever impact comes with the increased visitor traffic. Now, capacity within those institutions is both the space, the number of beds, but as I'm learning, it's even more incumbent on being able to have enough healthcare workers available, to be able to staff the bed capacity that we have in each of the hospitals, and just as importantly, to keep our own local staff of healthcare workers from burning themselves out. The last report I got late last week was that the state of Hawaii at that time was diligently trying to contract up to 500 nurses and medical technicians, which is an exercise that we had to implement back in the early fall. This time around, I'm told that it's going to be even more challenging because as multiple states experience a COVID surge, the demand for nurses coming in from out of state, escalates, and it becomes a very competitive environment. So I'm hoping that our folks at the Department of Health can achieve the goals that they've set in that area.
I want to follow up on that. So even if the trusted travel partners, let's say, we don't necessarily need that, or trusted testing partners, we don't necessarily need that because testing is so widely available. Do you think that adding a booster requirement has been discussed, or adding a testing requirement? Do you think that that would be appropriate right now? Is that something HTA would support?
The HTA has supported from the outset vaccinations, and so that would be to make sure that as many of our local people as well as visitors are vaccinated, level 1. What we're learning about the Omicron is that the booster is something that will add another protective shield from, if not the virus itself, from the impact that it would have if you did come down with COVID from the Omicron variant. Our number one focus is really the safety that we can provide, again, first to our local workforce, the community at large, because only then can we provide a safe environment for the visitor. And the more data that we get and the more expertise that weighs in, we're going to take our lead from those experts. And at some point in time, there's going to be a decision made on what new restrictions need to be imposed. But again, that'll be driven by statistical data relative to hospitalizations and the rate of infection. So, every day, those areas are subject to all kinds of considerations and restrictions imposed. And frankly, at HTA, we will respond accordingly and help get our industry aligned. The less restrictions, obviously, the better for business. Okay, but at some point in time, there are people charged with the decision. And in my mind, it comes down to 5 CEOs. One's called the governor, and 4 of them are called mayors, right? And they're having to make the tough decisions based on the information and data they're receiving from the Department of Health and from their health experts at the county level as well. And so, I choose not to second guess them, and will support the decisions that come forward, including the fact that they haven't imposed new restrictions at this time, and really trying to find a nexus as to where we can balance community safety, the well-being of our public health, as well as keeping our economy moving forward.
One of the things that you mentioned in one of your earlier responses was the impact to surrounding communities and neighborhoods. And we have a question here from Heidi that asks, can you please ask about how HCA is supporting residents reclaim neighborhoods by working to close illegal Airbnb and STVR? What are your thoughts of the city's plan to really crack down on this area? And how do you feel overall that this industry, such as Airbnbs and these vacation rentals, will be looking to change some of the dynamics that happen as we head into 2022?
You got to keep your eye on Bill 41. We are in total support of the bill itself. We know that it's been subject to intense community debate, and all perspectives need to be brought forward. But we actually believe that the original bill that came out, the thought that went behind it, we received an early briefing from Department of Permitting and Planning on what the intent was. But any effort to prevent the operation of illegal vacation rentals and the spread of illegal vacation rentals is something we support. Keep in mind, we went from 8 million visitors annually to 10 million for. That growth of 2.4 million really occurred with no net increase in the number of hotel rooms in the inventory. And so the illegal inventory of vacation rentals now has visitors in areas that, frankly, they don't belong. And I don't know of anyone, frankly, I'm sure you don't know of anyone who really wants to live next to a neighbor that's changing every 7 days. And the complaints that we've been having to deal with in terms of the night of arrival parties and the night before the departure parties, as anecdotally, we've received so many complaints about that. But it behooves the entire state, not just the city and county of Honolulu, to pay attention to this, because our zoning capacity throughout the state has identified places where resort activity belongs. Conversely, it's also identified places it doesn't belong. And if we start breaking down that system of discipline, we're just going to end up offending more neighborhoods, and the Kama'aina experience of living in a community in a neighborhood that was not identified to be a resort pod. So I encourage all the viewers and listeners to pay strict attention to this, because it has an impact on the way of life that we enjoy here.
There's a discussion happening in the comments now about cruise ships. Bottom line, Paula wants to know, when will cruise ships return? When are you expecting that?
My current information says there's one coming through on January 15th that is on a world voyage. So it's not one that is going island to island. That one, I'm told, is scheduled on the 15th. The current plans for the inter-island cruise ship to return under NCL, I'm told, is January 22nd. Now, let me emphasize something, that no cruise ship can dock in Hawaii unless it first docks in Honolulu. Nobody can dock in Honolulu unless they have completed a memorandum of understanding and a memorandum of agreement with the Department of Transportation, Department of Harbors, and the Department of Health. And these are pretty lengthy, detailed documents of what is expected of your cruise operation if you achieve this memorandum of agreement. It's very thorough. I commend NCL Cruises for the attention that they gave to it. And I also appreciate the steps they're taking to not open their cruises at full occupancy. I'm told that they're starting at should the demand be there, at a 60% level, and then measure incrementally how they grow operationally to take it back to full capacity. In addition to that, they've identified and committed certain isolation rooms should they encounter a COVID positive passenger. And then they've also had to elevate their medical teams on each of the cruise ships. And I was surprised to find out that they, at NCL in particular, have completely redone their air systems, so that they're not just recirculating the air, taking the technology that's used on aircraft so that fresh air is passing through the ship. They've done, in my estimation, everything that you can possibly do. But in the end, we're also dealing with a very fragile environment with this Omicron. In days past, just last week, a couple of cruise ships throughout the world have experienced surges within their the cruises that they're on right now. So this is very delicate, and I appreciate all the steps that have been taken. And in the memorandum of agreement with the state, there are certain triggers that and certain milestones that could end up modifying the agreement or causing the ship to be turned away in an extreme situation. So hats off to the people at Harbors and Transportation and DOH, because they've been very thorough in making sure that the reintroduction of cruises into Hawaii, that as many of the safeguards and protections have been built in.
Another question we have is from Mike saying, how will the new 3% hotel tax going to impact arrivals next year? Of course, Mike's question is in reference to the changes that has been made to the TAT statewide, with each county now being able to add this additional 3%. If you can provide an update on how you think that will impact the state overall and all these counties, and has the HCA done any projections to project what they anticipate will each county might receive, and how this overall will impact tourism?
Let me say this. This isn't really kind of like rocket science, right? I mean, just think about the three of us when we decide to go visit someplace, and at the time we book, it's 10.25% is the transient accommodation tax, and before we depart on the trip, it's now an added 3%, right? None of us are going to be happy about it, and so, but it is the law. The counties have been and the mayors in particular have met once a month. We meet as a industry, hotel general managers, members of the Hotel Association, Hotel and Lodging Tourism Association, and the chapters of the Hawaii Visitors and Conventions Bureau. So once a month, all of the members meet with each of the mayors, and we convene it at HTA. And so since this became law, the industry leaders have had an opportunity to speak directly to each of the mayors about it. And the mayors have been forthright about the timing with which they need to move, because everybody knows that the visitor impacts are being made in each county, and the county cannot sit there with $0 going to places like county parks, lifeguards, emergency workers, first responders, all of whom the industry counts on. So I think once the bill came through that authorized the counties to do it, none of us in the industry were happy about it, right? But it is the new reality. The challenge became the implementation of the added tax. Again, going back to somebody who booked it before it became law, but is traveling after it became law, and how you deal with those elements and the sensitivity around that, especially when you're looking at long-term bookings that were done years ago in the area of meetings and conventions in particular. I will say this, though, that the counties have tried their very best to be sensitive to the needs and desires of the industry under this new law. And in answer to your question, Ryan, I don't have any specific data. DBED and the counties would, and it would be something that we could access as well. But here's what the real proof of this is going to come a year from now, 2 years from now, when the community and the industry begins to see this tax being spent on better maintenance in our parks, the public restrooms being elevated to a standard of cleanliness and sanitation that we can all be proud of. When those monies that are being collected are being spent in areas that improve the community experience and the visitor experience, I believe we'll all get past the immediate shock of the added 3%. And I'm confident that the mayors are cognizant of this and will spend this new pot of money wisely and in ways that will benefit both the community and the visitor industry.
I'd like you to respond to, there's two comments here. I want to read both of them and get your thoughts on this, because there is this perception that there are a lot of visitors who are either bringing COVID to the islands or getting stuck here with it. Nani says, the tourists contributing to COVID counts for sure, but leaders are not going to say that. And then, hold on, I got it right here. Here we go. Marielle says, oh yeah, here we go. Are the Canadians who are testing positive at the end of their trip able to find accommodations to quarantine. And I'd like to expand that to not just Canadians, but other visitors as well. Are you seeing, because we've also heard the Visitor Aloha Society saying that they're having to help tourists who are now being forced to quarantine because they test positive at the end of their trip, at least more calls than they're used to getting, which is obviously zero before the pandemic. But is there a lot of COVID happening in the visitors themselves? And are you seeing people actually getting stuck here? Is that a perception or is that reality?
No, I think it is a reality. I couldn't quantify it for you today, but I will say this. The fact that they're having to test before they return to their home country, visitors are the ones that are tested positive and unable to return will bear the responsibility of underwriting the cost of an extended stay in isolation. Okay. Now, what you can imagine is happening is few people set out on their vacation saying, I need to have a budget in the event I have to stay an added 10 days or whatever the isolation period is, right? Depending on your nation's policy. So that has been a difficult area to manage. I will say that the folks at VASH have responded as best they can with the resources they have. Now, when somebody is tested positive, the immediate thought is, I can't really afford to do this, right? And if you don't manage that well and actually, I don't want to use the term push, but actually examine each individual case, we're gonna end up opening a cottage industry here of underwriting, complimentary stays because of isolation, which we cannot do. So the reports that we've been getting is that hotels have been trying their best to accommodate that, while at the same time holding the visitor financially responsible, and credit goes out to the folks at VASH who are trying their very best to catch the ones that are falling through the cracks. But no one should think that the visitor or the visitor industry is above the fact that infections are setting in, and there is a concern, however, that the visitor industry is getting blamed for much more of this spread than what's happening with our own outbreaks in the local community. But at the end of the day, whether it's a visitor or whether it's a Kama'aina resident, the fact is that we're going to have to get better as we move through Omicron and learn our way through it to just manage it comprehensively, whether it's local, resident, or visitor. And I commend the hotels for the extent to which they're willing to accommodate some of these cases.
Our time is already up. Hard to believe the half hour goes so quickly. But before we end, I did want to just allow you an opportunity to share your final thoughts as we look into 2022 and what the future for tourism looks like here in the state of Hawaii and the role of HTA in the efforts to help build back this important sector of our economy.
Something really special happened during this pandemic. We went from a record banner year in calendar year 2019, right, with the greatest number of visitors. And then 6 months later, we went to near zero. And you heard me say this the last time we were together. There's almost a euphoric sense, right, that we as local residents had, because our favorite beaches, our favorite shopping malls, all of that was uncrowded. And so to a great extent, we felt like we got our islands back. And then the longer this economic collapse lingered, the more we began to learn and appreciate the fact that thousands of local people and families were being injured by this collapse, the loss of jobs, the expiration of federal programs to subsidize the collapse, all of those things. So what I want to say is that the community voice about what they want to see in tourism going forward. And what they don't want to see is very loud, very pronounced. And basically, the community is calling for a different model of tourism, which is causing us to have to project to see what kind of Hawaii, first of all, do we want 3 generations from now. In parallel, what kind of visitor industry do we want 3 generations from now? Once we identify that, we'll be able to make the decisions as to what we need to do today to ensure that Hawaii is more resilient, more vibrant, has an economy that we can all be proud of, has a visitor industry that is very unique in the world. But I want people on this telecast to know that the voices of the community are weighing heavily into the way we view our work going forward. And for that, I'm grateful. So thank you.
Well, we thank you for joining us this morning. HTA CEO John DeFries, thank you so much for your time.
Happy New Year.
Happy New Year. Well, Ryan, good to hear from him, and very interesting to hear about, just at the top, the visitor arrivals, over 30,000 daily arrivals around there. About a third of those could be returning Kama'aina. So about 80% of the levels, he said, of what we saw pre-pandemic, which is still pretty high. But the profile of the visitor who we saw coming here now versus in the summer is a little different. They're coming from colder climates, and it sounds like more people who have been here before, as opposed to the first time tourists that we saw coming here over the summer, and not necessarily the big rush that we saw in those June, July months. Oh, and I think you're muted.
And he remains optimistic that despite some of the numbers that we are seeing with Omicron, that the tourism industry will rebound. But again, a lot will be determined by how this new variant impacts the way in people want to travel overall. We heard from him of the efforts that the hospitality industry is taking, again, to once again ensure that their workers are safe, but recognizing that the cancellation in flights that we have been seeing in the past weekend, and ultimately could be seeing for some time going forward as Omicron continues to spread, will definitely impact the visitor industry, with some travel changes that need to be made and accommodations that need to be adjusted for those visitors who are either coming or going from the state. He also mentioned that there has been no official word that he's received about changes to the Safe Travels program and adding in back that testing requirement, but noting, however, that if that change were to happen, that the tested partner portion of the program may not be as important anymore because of the fact that testing options are widely available. We also heard from him speak about how the new change in the TAT tax moving forward will impact the hospitality industry as a whole.
Yes, and interesting to note that we could see cruise ships returning to the islands in as little as about 2 weeks. He said January 15th, around there, a cruise ship that is coming internationally could be docking in Honolulu, and a week or two after that, we could see the inter-island cruises continue or restart again. That would be a big change. Of course, we haven't seen cruise ships in nearly 2 years, so a lot of people watching that. There have been cases of, COVID, obviously, on cruises that are ongoing right now. So there's a lot of trepidation when it comes to allowing these cruises to dock on our shores. But he did say that there is a laundry list of requirements that those visitors need to agree to before they are allowed to set foot in the islands. And he is confident that the safety precautions will be in place before they are allowed to dock.
Yeah, and also echoing, you could hear in his final statement, again, reiterating that the HTA, as well as officials, have heard the concerns of the community after what happened over the summer with the influx of tourists, and how many locals felt that it was this influx was impacting the daily lives of those residents here in Hawaii, saying that the concerns have been heard and they are being factored in. Again, remember, John DeFries is someone who has taken over in this position during the middle of the pandemic, and so he has had to navigate through changes that has been made to the overall structure of the HTA, with changes that were made by the legislature, as well as the impact of the pandemic. But someone who feels that he owes a responsibility to the community, that he understands the concerns. And again, you heard it in his final statement there, recognizing those concerns and those voices of the community, saying that they will continue to hold those leaders accountable in the hospitality industry, but also be sure to pay attention to those voices.
On Friday, we are going to be talking with Dr. Tim Brown of the East-West Center. I know a lot of you have been asking for him to come back. He, of course, is an infectious disease expert looking at pandemics, throughout history, and of course this one. And he's heavily focused on models, and hopefully can give us some insights into the outlook of 2022. If you look at the Department of Health dashboard, Honolulu County now at 15.3% test positivity. That curve just seeming to go up, although you do see it flattening just a little, but it's flattening at the top. So where is that going, and how much longer, where is the ceiling in the case count, and what can we expect in the next few months, even in the next few days and weeks? We're going to be talking about that with Tim Brown on Friday right here at 10:30.
We'll see you then. Aloha.
This episode of Spotlight Hawaii is brought to you by Beachside Roofing.